Thank you, and good afternoon. Just sitting here hearing the stories and the enthusiasm, the will, the power of all the advocates here has just been quite a privilege. It really is a privilege to be here. And I want to thank the Every Life Foundation, Congresswoman Matsui, the other co-chairs, our sponsors, and all of you who have come out to learn more about the Orphan Drug Act and what needs to be done. So, again, I work for the Foundation Fighting Blindness. We fund research for inherited retinal diseases, and we've been around for about 50 years. We've raised nearly $900 million for research to overcome these conditions. And the Orphan Drug Act has been critical to attracting commercial investment in the research that we fund. Our role is really to get research to the point where we can attract outside investment. And without the Orphan Drug Act, we just wouldn't be able to do that. So we fund research for conditions that cause progressive vision loss and blindness due to genetic mutations that affect the retina. And these conditions go by names like retinitis pigmentosa, Stargardt disease, Usher syndrome, choroideremia. There are many. And they're very challenging because they're usually diagnosed in childhood. And the diagnosis is devastating. If you can imagine your child being diagnosed with a condition that will make he or she blind. And they progress over time. Sometimes they lead to legal blindness or total blindness. But I wanted to read you a story from one of our constituents who has one of these conditions called Stargardt disease. If you've ever heard of macular degeneration, age-related affects people because they're getting older. Stargardt disease is a form of macular degeneration that affects young people. It's usually diagnosed in children or young adults. And it's progressive. It gets worse over time. So the gentleman whose story I'm going to read, his name is Greg. He's in his mid-30s. He was diagnosed with Stargardt disease at the age of 7. So this is what he wrote. Every morning, I only have to reach for my toothbrush before I'm reminded of all the extra challenges I'll face for the rest of the day because I'm legally blind due to an inherited visual disorder called Stargardt disease. Then I mentally grit my teeth, hold my toothbrush up about an inch from my eye to gently apply my toothpaste, and start taking on the challenges of the day. One of my biggest frustrations is struggling to connect with people. I almost literally have to bump into my colleagues in the hallway to have a chance of recognizing them. I lack central vision and have to look off to the side to see them. One result is that I don't make eye contact with people, which often makes people uncomfortable and leaves them feeling like I must not want to talk. I groan internally every time I go to a meeting and I'm given a name tag because I know I'm still going to have to ask people their names and repeatedly endure them responding with blank stares or holding their own name tags up while I explain why I have to ask. As a scientist who travels for meetings frequently, these ego-bruising interactions often come shortly after struggling to navigate unfamiliar airports, trains, towns, and buildings. I rely a lot on a telescope and other emerging devices, magnifying devices that I carry around everywhere, and I need to ask people for help frequently. The tasks I need help with are often so simple that I get blank stares and have to explain my vision problem before people understand what I'm asking for. Even my closest relationships are impacted. My daughter, my young daughter, loves to be read to, but she understandably wants to see the pictures and gets frustrated when I have to hold my head so close to the page to see it. And so she wants her mom to read to her, understandably, and I miss out on the chance to bond with her. He goes on to say, thank God for all the technology I have to make life possible in the face of these challenges. I pray that people will keep investing in research on treatments and technology in the hopes that life will get easier someday, or at least not get harder when my vision loss progresses further. So a virtual thank you to Greg for sharing that story. And I wanted to conclude by mentioning that we're working with a company, a partner of ours called Alnylam Pharmaceuticals, and they develop what's called RNA interference, which is a technology, a fancy genetic technology to correct genetic defects. And excitingly, they're interested in pursuing Stargardt disease. And one approach that they considered was repurposing a drug called vutrisiran that's already FDA approved for a rare disease called ATTR amyloidosis with polyneuropathy. So again, this is a rare disease. But what has discouraged them is because of a clause in the Inflation Reduction Act, this repurposing would make the drug applicable to a second indication. And it would not enable them to be exempt for Medicare pricing negotiation. Medicare pricing negotiation exemption is good if you're just using the drug for one condition. But once you move out for a second condition, then you're no longer exempt. So because of that, they can't move this drug into the phase 3 trial that they had planned. They still want to address Stargardt disease, but they need to develop a drug that isn't as clinically developed and start at an earlier stage. And so that means the drug won't get to patients as quickly, and it will take more research and development to get it into a clinical trial. Alnylam goes on to say that they're very supportive of the Inflation Reduction Act, but just wanted to raise awareness about this one exemption that's so important. They hope that it'll be expanded beyond one drug. So thank you for listening to our patient story, learning more about the Foundation Fighting Blindness and one of our pharmaceutical partners. And again, thank you all for coming out today to support the Orphan Drug Act and doing more to expand it.